Medical terminology is the language of healthcare professionals. It's a specialized vocabulary used to describe the human body, its functions, diseases, and treatments. This language uses a system of building blocks, combining prefixes, roots, and suffixes to create meaningful terms. For example, the term cardiomyopathy can be broken down into three parts: cardio, heart, myo, muscle, and pathy, disease. By understanding the meaning of each part, we can easily understand that cardiomyopathy refers to a disease of the heart muscle. Medical terminology provides a clear and concise way to communicate medical information among healthcare professionals. It eliminates ambiguity and ensures that everyone understands each other, regardless of their native language. In essence, medical terminology is the foundation upon which effective healthcare communication is built. Pharmacy students must become fluent in medical terminology to excel in their studies and future careers. As future pharmacists, they'll be responsible for dispensing medications, counseling patients, and working closely with other healthcare professionals. All of these tasks require a strong command of medical language. Imagine a patient asking for a refill of their antihypertensive medication. A pharmacist well-versed in medical terminology would immediately recognize that the patient needs medication to lower their blood pressure. Understanding medical terminology allows pharmacy students to grasp complex pharmacological concepts more easily. This deeper understanding translates into better patient care and medication management. Pharmacists need to be able to read and comprehend medical prescriptions, research articles, and drug information sheets. Without a strong foundation in this language, pharmacists would be unable to perform their duties effectively. Mastering medical terminology empowers them to communicate effectively, make informed decisions, and provide optimal patient care. To unlock the secrets of medical terminology, it's crucial to understand its fundamental building blocks: prefixes, roots, and suffixes. These elements, often derived from Greek and Latin origins, combine to form complete medical terms, much like letters form words. Prefixes, appearing at the beginning of a word, typically indicate location, time, number, or status. For instance, hyper signifies above or excessive, as seen in hypertension, high blood pressure. Conversely, hypo denotes below or deficient, like in hypoglycemia, low blood sugar. Roots, forming the core of the word, represent the body part, organ, or system involved. Some common examples include cardi, heart, gaster, stomach, and nerve. Suffixes, attached at the end, often indicate a condition, procedure, or disease. For example, itis signifies inflammation, as in arthritis, inflammation of the joints. Understanding these building blocks empowers you to dissect complex medical terms with ease. Analyzing medical terms might seem daunting at first, but with a systematic approach, it becomes a manageable and even enjoyable puzzle. Here's a step-by-step guide to help you decipher the meaning of unfamiliar medical words. First, identify the suffix. Begin by identifying the suffix, as it often reveals the category of the term, such as a condition, procedure, or disease. For example, in the term appendicitis, the suffix itis indicates inflammation. Next, examine the prefix if present. Look for a prefix, which can provide additional information about the location, time, or degree of the condition. In hyperthyroidism, the prefix hyper signifies excessive activity of the thyroid gland. Then determine the root. Identify the root, which represents the body part or system involved. In cardiomyopathy, the root cardi refers to the heart, while myo indicates muscle. Finally, combine the meanings. Once you've identified the individual components, combine their meanings to understand the overall term. By following this step-by-step approach, you can confidently dissect and comprehend even the most complex medical terms. Section 5. Building blocks of language. Constructing new medical terms. Once you've mastered analyzing existing medical terms, you can take your skills a step further by learning to construct new ones. This skill proves invaluable when describing new conditions, procedures, or discoveries in the medical field. Building new medical terms relies on the same principles of combining prefixes, roots, and suffixes. For instance, to describe a surgical procedure for removing a kidney stone, combine the root nephro, kidney, the suffix litho, stone, and the suffix tomi, surgical incision, to create the term nephrolithotomy. Similarly, for a new condition characterized by inflammation of the liver and spleen, combine the roots hepat, liver, and spleen, with the suffix itis, inflammation, to form the term hepatosplenitis. Consulting medical dictionaries and resources can help you select the correct elements and ensure that your constructed terms are both accurate and widely understood within the medical community. By mastering the art of constructing new medical terms, you contribute to the evolution of medical language, enabling clearer communication and facilitating advancements in healthcare. Section 6. Mastering pronunciation, speaking the language of medicine. While understanding the meaning of medical terms is crucial, being able to pronounce them correctly is equally important for effective communication in healthcare settings. Mispronouncing medical terminology can lead to misunderstandings, confusion, and even potential errors in patient care. One helpful tip for pronouncing medical terms is to break them down into their individual syllables. This approach not only simplifies the pronunciation, but also reinforces your understanding of the term's structure and meaning. For example, instead of struggling with electrocardiogram, break it down into electrocardiogram. Another useful strategy is to pay attention to the emphasis placed on each syllable. In many medical terms, the emphasis falls on a specific syllable, and misplacing it can alter the meaning or make the word difficult to understand. Familiarizing yourself with common phonetic rules and patterns in medical terminology can also significantly improve your pronunciation. By actively practicing pronunciation and seeking guidance when needed, you can confidently and accurately communicate using medical terminology. Section 7. Resources and tools for success. Navigating the vast world of medical terminology can feel overwhelming, but numerous resources and tools are available to support your learning journey and empower you to master this specialized language. These resources cater to different learning styles and preferences, ensuring that you can find the tools that best suit your needs. Medical dictionaries, both in print and online versions, serve as invaluable companions for deciphering unfamiliar terms, understanding their etymology, and verifying pronunciation. Popular choices include Stedman's Medical Dictionary, Dorland's Illustrated Medical Dictionary, and Tabor's Cyclopedic Medical Dictionary. Flashcards prove particularly effective for memorizing medical terms, prefixes, roots, and suffixes. You can create your own flashcards or utilize pre-made decks available online and through mobile apps. Some popular flashcard apps for medical terminology include Anki, Quizlet, and Memrise. Interactive websites and software programs offer engaging ways to learn and practice medical terminology. These platforms often feature games, quizzes, and interactive exercises that make learning fun and effective. Mobile applications provide convenient on-the-go access to medical terminology resources. Many apps offer features like flashcards, quizzes, audio pronunciations, and even augmented reality experiences that enhance your learning experience. By utilizing a combination of these resources and tailoring them to your individual learning style, you can effectively learn, practice, and retain medical terminology. Section 8. The Power of Practice. Tips for effective learning. Mastering medical terminology requires consistent effort and effective strategies. Here are some valuable tips to enhance your learning experience. Context is key. Understand terms in context. Read articles and case studies. Break down complex terms. Analyze prefixes, roots, and suffixes. Visualize and associate terms. Use active recall and spaced repetition. Teach concepts to others. Make learning fun and engaging. Stay curious and persistent. Section 9. Conclusion. Embracing the language of healthcare. In conclusion, mastering medical terminology is an indispensable skill for pharmacy students and aspiring healthcare professionals. This specialized language forms the bedrock of effective communication, enabling clear and accurate exchange of information among healthcare providers, researchers, and patients alike. By delving into the fascinating world of prefixes, roots, and suffixes, we unlock the ability to decipher complex medical terms, understand their meaning, and even construct new ones to describe emerging medical concepts. This knowledge empowers us to navigate the ever-evolving landscape of healthcare with confidence and precision. By mastering medical terminology, we equip ourselves with an invaluable tool for success, enabling us to communicate effectively, make informed decisions, and ultimately contribute to a healthier future for all.